I'm going to share MCQs of oral pathology dentogist, chapter number 1, development and disturbances. First MCQ is enamel demineralization starts at pH, and the answer is डेल्टा 5.2 to 5.5. ठीक है, आप इसकी जो एक्सप्लेनेशन है उसको भी रीड कर सकते हैं, और ये शेफर्स बुक जो है वहाँ से MCQ बने हुए हैं. एंड क्वेश्चन नंबर 2 इज द मोस्ट इनिशियल साइन ऑफ फ्लोरोसिस इज. आंसर इज बी इनामल ओपेसिटी. एंड आप इसकी एक्सप्लेनेशन जो है वो भी देख सकते हैं, जो हमारे पास फ्लोरोसिस वाली है, माइल्ड मॉडरेट वगैरह जो बुक पे भी लिखी हुई है. ठीक है, उससे रिलेटेड MCQ आया हुआ है. देन थर्ड क्वेश्चन इज हाइपोप्लेजिया ड्यू टू लोकल ट्रॉमा. द आंसर इज टर्नर्स टूथ अल्फा. ठीक है, ये भी आपकी बुक की लाइन्स हैं. ठीक है, वहाँ पे भी लिखा हुआ है टर्नर्स इनामल हाइपोप्लेजिया में. द नेक्स्ट क्वेश्चन इज येलो ग्रीन पिगमेंटेशन ऑफ द टीथ इज सीन इन. द आंसर इज erythroblastoses fetalis, and you can see his explanation. The next question is the condition is due to defect in the normal keratinization of the oral mucosa. The answer is beta wire sponge nevus. ठीक है, ये सारी आपकी बुक्स की लाइन है. The next question is enlargement of the crown at the expense of root is called. The answer is periodontism. The next question is in hypodontia the more commonly affected tooth is. The answer is permanent third molar. The next question is the abnormality of the tooth morphology in cleft lip and the palate patients are most observed in primary and permanent. The answer is axillary incisors. The next question is chromosome number related to dentinogenesis imperfecta. Answer is chromosome number 4. Next question is till what age tetracycline should not be given to prevent discoloration. The answer is 8 years. आप इसका एक्सप्लेनेशन भी देख सकते हैं. Then the next question is minimum dose of tetracycline which will show tooth discoloration is. Answer beta. Then the next question is most characteristic feature of mandibulofacial diastasis is. The answer is normal vein with column. ठीक है. Then the next question is which of the following is true macrodontia lateral incisor. The answer is peg lateralis. Peg lateralis. ठीक है. The next question is patient having extra X chromosomes exhibit. The answer is periodontism. इसमें Klinefelter syndrome जो है वो ऐसा रहता है. Then the next question is tooth bud splits into two giving rise to two crowns with a single root is called. The answer is is the gemination. And the next question is non-ulcerated pigmented fast growing layer on maxillary alveolar ridge of the infant is. The answer is melanotic neuroectodermal tumor. Then the next question is 17. Which of the following is correct about cleft lip and cleft palate? The answer is multifactorial triad. इसकी एक्सप्लेनेशन जो है वो भी आप देख सकते हैं. Then the next question is 1-year-old patient normal at the time of birth is having copious discharge and gross facial features, thick lips, large tongue, large bulging head, and flattened nose. On examination, it was found that he has enlarged liver and spleen. What will be the diagnosis? The answer is Hurler syndrome. Then the next question is white discoloration seen on recently erupted permanent central incisors of a child who had suffered injury in deciduous third teeth 3 years back. Like diagnosis is the answer is Turner hypoplasia. The next question is developmental cysts arise due to. The answer of the 20 question is inclusion of the epithelial cells between embryonic fusion lines. Question number 21 is a union of roots of adjacent traits through the cementum is referred to as. The answer is congruence. ठीक है डेफिनेशन ही पूछी हुई है. The next question is primary enamel hypoplasia is a disturbance of. The answer is ectoderm. The next question is hypodontia seen in all except. The answer is osteoporosis. ये आप सारे इसके क्लिनिकल फीचर्स जो हैं वो भी देख सकते हैं कितने ज़्यादा इसके हाइपोडोंशिया के. वीडियो को काइंडली जरूर लाइक करते हैं, शेयर करते हैं. थैंक यू सो मच. The next question is in Down syndrome, child who is mentally retarded have most probably. The answer is trisomy 21. Down syndrome ये अभी आपकी बुक की लाइन है. The next question is tarodontism Burl's teeth are formed by. The answer is failure of invagination at proper horizontal locations of HERS, herpes epithelial root sheath. The next question is high attachment of tongue's ventral surface to the floor of the mouth is called. The answer is ankyloglossia. Ankyloglossia. ठीक है, ये भी आपकी बुक में है टॉपिक. The next question is supernumerary tooth within our tooth is most commonly seen in. The answer is maxillary lateral incisor. जो sometimes invaginators dentine भी कहते हैं. ये भी आपकी बुक की यहाँ सारे तकरीबन आपकी बुक की लाइन्स ही हैं. बुक के जो टॉपिक्स हैं उनकी ही लाइन्स के MCQs बने हुए हैं. The next question is Hutchinson's trait includes all of the following except. The answer is pag-lateral. आप explanation भी देख सकते हैं. And the next question is endoderm, mesoderm, and ectoderm, all germ layers are present in which of the following? The answer is teratoma. ठीक है. Then the next question is a patient has normal maxillary and mandibular primary teeth but permanent teeth in maxillary and mandibular anterior region are smaller than normal. Which of the following is true about it? The answer is generalized developmental microdontia. ठीक है, types of microdontia: true, relative, focal, isolated. ये भी आप देख सकते हैं. Then the next question is, what is the most likely condition depicted above? Then the answer is Tracker-Collins syndrome. इसका फीचर्स भी देख सकते हैं. इसे हम मैंडिबुलोफेशियल डायसोस्टोसिस भी कहते हैं. Then the next question is, Perry-Rombert syndrome is associated with. The answer is hemifacial atrophy. Then the next question is, the syndrome associated with predisposition for squamous cell carcinoma of pharyngeal region is squamous is. The answer is Palmer-Vinson syndrome. Then the next question is, delayed eruption of the teeth is seen in all of the following conditions except. The answer is hyperthyroidism. And delayed eruption जो है वो seen in the conditions like Ricketts zone syndrome, Trebizond सारे लिखे हुए हैं, ये भी आप पढ़ सकते हैं, related भी पूछा जा सकता है. And the next MCQ is, Melkerson-Rosenthal syndrome does not have. The answer is hemifacial hypertrophy. ठीक है. Then the next question is, molted enamel in dental fluorosis is due to. The answer is excessive fluoride affecting the ameloblast during the tooth formation stage. The next question is, following are true about thyroglossal cyst except. The answer is moves downward on tongue protrusion. Then the next question is, the characteristics histological appearance of lava flowing around boulders is seen in. The answer is dentine dysplasia. Type 1 radicular dentine dysplasia में ये हमें नजर आती है. ठीक है. Then the next question is, then हाफ MCQs रह गए हैं, वो मैं नेक्स्ट वीडियो में जब अपलोड करूँगी. वीडियो अच्छी लगी तो जरूर लाइक कीजिएगा, सब्सक्राइब कीजिएगा, और बाकी टॉपिक्स जो है रिलेटेड भी आई विल शेयर. ठीक है. थैंक यू सो मच.